This is One on One. This conference that we're at here in South Jersey has been put together by the folks at Virtua. It is called The Evolving Role of Telemedicine, Driving Quality, Access, and Cost Savings. And the team here that's put it together has been led by Rich Miller, the President and Chief Executive Officer at Virtua. Rich, I just finished a terrific, not that I was terrific, but the panel was terrific and the audience was great, dealing with public policy questions around telehealth, telemedicine. Why the conference overall? Because, I mean, everyone who is anyone in the area of healthcare is here.
Well, it's important. It's important to get the messaging out about the use of telemedicine, which we've been heavily engaged with for years now, Steve. So, it's used in all venues. It's used in the hospital. It's used at home. It's used in the primary care offices. So it's becoming a mainstream part of how we deliver patient care.
So talk about it. I mean, the definition of telemedicine, I'm not going to say it's complex, but it's multifaceted.
It is multifaceted. So there's different ways. Telemedicine has different definitions to it. So, for example, the patient comes in the emergency room with a stroke. We can do telemedicine, connect that patient to a neurologist to find out the depth of the stroke. And the neurologist can be anywhere in the country examining this patient. That's how well-defined the systems are today to be able to do that. So that's one example. And then the example of patients now that are at home with chronic disease, say a patient has congestive heart failure, and we need to monitor them at home. We can do that as well through our home health aides and our nurses, be able to monitor patients at home.
So it's so interesting. It's everything in between, from the most sophisticated, stroke-related, with a neurologist, right?
Right.
With someone who's dealing with a chronic disease, chronic issue with their physician, they want to have a telephone conversation.
And it's as simple too, Steve, as a person with a bad cold that might need to connect to a primary care physician through Teledoc, which we offer to our community, and they call, they get a primary care physician, and they get a script for their cold. So it ranges from very simple episodic care to extreme stroke care. I mean, it's that, and even telepsychiatry, which is done now in the emergency room through that. So it could be complex or simple.
Let's talk a little bit about this. So I'm thinking about people's traditional paradigm or view of hospitals. You want to have people in the hospital because that's how you make your money. But it seems counterintuitive because it's like, hold on, if we're doing this telemedicine, telehealth thing, they're not in the hospital. Right. They're at home. Right. They're communicating with their clinical professional, not in the hospital, but where they are. Explain that.
Well, it's a way to get patients and the consumer connected to patient care. So in other words, 50% of our community does not have a primary care physician. It's an amazing statistic, but approximately 50%. So how do we connect, for example, that patient to a physician? If they're not connecting, going to an office environment, seeing their doctor, we still want them to receive care and take care of their chronic disease conditions. So in a way, it's really promoting health and wellness to the consumer, so they're seeing physicians. Now, what we would like to do, because we still think, Steve, there is a great importance of having that physical contact with your physician personally. So, we could see somebody through telemedicine, then eventually connect them personally.
When you spoke this morning, when you kicked off this conference with these terrific healthcare professionals from across the region, you talked about telemedicine, telehealth as a tool, part of a toolkit. Right, it's not the whole toolkit, but it's part of a toolkit, medical, clinical, healthcare toolkit. Talk about that.
Well, what it is it's part of what we do for patients. Some patients want the personal contact with their physician. Some patients don't want personal contact constantly with their physician. That's the way it is. It's the society we live in. But the goal overall is to have all the tools in the toolkit that we can provide access to the community for patient care. So they feel, if I'm home and I'm really sick and I have a bad flu and I don't want to leave my house, what access do I have to?
You have to come to the office.
You have to come to the office to see the doctor. And sometimes that's not practical. It's not practical for a mom that's working with 2 kids to get out of the house and see their doctor all the time because they can't do that. So to provide different points of access to the community is going to be critical in the future care of people.
Millennials and telehealth.
Right, millennials, whole different animal. I mean, I have 2 daughters. They're 33 and 30, and I have to tell you something. And then I have 2 grandchildren. That's a whole nother story where everything's done off of an iPad. So millennials and the next generation are going to be looking for tools much different than I'm a baby boomer, much different than me. And I'm looking for tools. But personal contact may be a little bit more important to me. Millennials, it's not as important. It's getting the appointment quickly through their iPhone, getting to, calling Teledoc, getting what they need and moving on. Very, very important for millennials to have that.
We were talking with so many of the colleagues that were here today, and they were talking about the need for regulation, the need for the government to be involved here, and establishing some guidelines in terms of reimbursement, et cetera, et cetera. I mean, you know public policy, you deal in public policy, you've engaged in complex public policy and political issues, whether you like it or not. It's part of your job. How much should the government be involved in this?
Well, I mean, I can see a role for the government in this in terms of regulating the service to make sure you have the right providers in the network, that these are board-certified physicians that are providing service. What you don't want to do is over-regulate it so much that it becomes costly to the community to provide the service. And that's what we don't want to see. Typically, too much regulation leads to more cost and obstacles in getting care to patients. So some is required. I agree that we need some oversight in terms of the physician population and the way it's provided, but keep it at a minimum.
So require a certain amount, but overregulation is a problem. And just I want to be clear, what could overregulation actually produce?
Overregulation can actually produce the fact that we have to live up to standards that are beyond what we should be living to with telemedicine. In other words, does the telemedicine process become so cumbersome that we have so many levels of people involved in the process that we're adding so much cost to this? The goal of telemedicine is to make healthcare less expensive, to get access to people in a less expensive way. That's what we're going to try to do. Don't overregulate so that doesn't happen.
Final question. If I were to ask you what you see for telemedicine in the next 5 years, what would you say?
I think it's going to be a major explosion in how we deliver care. I really believe that a lot of physicians are really warming up to telemedicine. A lot of physicians weren't in favor of this, especially in the primary care world. Now they're seeing the benefits of what we're doing in telemedicine. So I think we're going to see a lot more, especially, Steve, with the shortage of physicians and clinicians in the United States today. We're recruiting primary care physicians. We'll take as many as we can get. They're hard to get. So if we have other avenues to care for patients, it's going to be important. And I think that's where you're going to see the explosion.
We need creative solutions.
Absolutely. If we're going to care for patients properly and we're going to have enough clinicians doing it, these are the solutions we need.
Thank you, Rich.
Thank you, Steve. I appreciate it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, the New Jersey Education Association, the Healthcare Foundation of New Jersey, Create, the Give Something Back Foundation, Adler Aphasia Center, and by the North Ward Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.